You know, a few years ago, my friend Linda called me with that voice, the one we all use when we're trying to sound brave but feel completely overwhelmed. She'd just been diagnosed with osteoporosis, and her doctor handed her a prescription. "Take this once a week," he said. And suddenly, Linda was staring at this little pill, wondering, will this actually help? What if it makes things worse? Sound familiar? If you're watching this, maybe you've had those same questions. Osteoporosis isn't just a brittle bone disease, it's personal. It's about staying active, gardening without worry, picking up your grandkids, or simply getting through the day without that nagging fear of a fracture. And when your doctor mentions medication, it can feel like a crossroads. Do the benefits outweigh the risks? What if I can't handle the side effects? Well, today, we're going to walk through this together. We'll talk about the most common osteoporosis medications, how they work, the good they can do, and the side effects to watch for. My goal isn't to tell you what to do, but to give you the clarity you need to have confident conversations with your doctor. Because knowledge? It's the first step toward taking back control. Let's start at the beginning. Osteoporosis weakens your bones over time, right? But here's what's happening beneath the surface. Your body's natural process of breaking down and rebuilding bone gets out of balance. Think of it like a savings account. If you're withdrawing more than you're depositing, eventually, you'll run into trouble. That's where medications come in. They're not a cure, but they can help tip the scales back in your favor. Now, the first type of medication many folks are prescribed is called a bisphosphonate. Names like Fosamax or Boniva might ring a bell. These drugs work by slowing down the cells that break down bone, giving your body a chance to rebuild what's been lost. For a lot of people, they're a game changer. Studies show they can cut the risk of spine fractures by half in some cases. That's huge. But here's the thing, bisphosphonates aren't a one-size-fits-all solution. Let's talk about the side effects, because I know that's what keeps many of us up at night. Most people handle these medications just fine, but some might feel heartburn or stomach aches. That's why doctors often recommend taking them first thing in the morning, on an empty stomach, with a full glass of water. And you'll need to stay upright for 30 minutes afterward, no lying down for a quick nap. It's a small routine, but it makes a big difference. Now, there's been a lot of chatter about rare side effects, like jaw problems or unusual fractures. Let me be clear, these are extremely uncommon, especially if you're only on the medication for a few years. But that's why your doctor will monitor you closely. It's all about balance, weighing the very real risk of a life-changing fracture against the small chance of complications. And that's a conversation only you and your care team can have. Now, bisphosphonates are often the first step, but they're not the only path. You might have heard friends talk about different medications, ones you take as shots, or even just once a year. And maybe you're wondering, is there something better out there for me? Well, that's exactly where we're headed next. Because understanding your options, how they work, what to expect, is how you find the right fit for your life, your body. Let's keep that conversation going. You know, when Linda first heard her doctor suggest a shot for her osteoporosis, she laughed. "I've had enough needles in my life," she told me. But here's the thing, sometimes, the options we're hesitant about turn out to be the ones that fit our lives best. Let's talk about one of those alternatives, denosumab, often known by the brand name Prolia. Unlike bisphosphonates, which you take orally, denosumab is an injection you get every 6 months. And how it works is pretty fascinating. Imagine your bones have a natural recycling crew, cells that break down old bone so new bone can form. Denosumab steps in like a friendly security guard, gently saying, "Hey, let's slow down that breakdown process." This gives your body more time to build bone, which can lead to stronger, denser bones over time. For folks who've had fractures or have severe osteoporosis, that's a big deal. Studies show it can reduce spine fractures by up to 70%. Now, I know what you're thinking, an injection? Really? But here's the upside: no daily or weekly pills to remember, no worrying about taking it on an empty stomach. You pop into your doctor's office twice a year, get the shot, and you're done. For someone who travels or just wants simplicity, that's gold. But, and there's always a but, there are a few things to watch for. Some people notice minor side effects, like muscle aches or a skin rash near the injection site. And in very rare cases, there's a risk of low calcium levels or infections. That's why your doctor will check your calcium and overall health regularly. It's all about staying one step ahead. Now, let's shift gears. What if your bones need more than just a slowdown signal? What if they need a boost? That's where teriparatide comes in, brand names like Forteo or Boncity. This medication is different because it's not a pill or a twice-a-year shot. It's a daily injection you give yourself at home, usually for up to 2 years. And here's why it's unique. Teriparatide is a synthetic version of a hormone your body already makes to stimulate bone growth. Think of it like a gentle nudge to your body's construction crew, saying, "Let's get building." For people with severe osteoporosis or those who've tried other medications without success, teriparatide can be life-changing. It's been shown to increase bone density significantly, especially in the spine. But, and this is important, it's not a long-term solution. After those 2 years, your doctor will likely switch you to another medication to maintain the bone you've built. It's like renovating a house and then putting a sturdy roof on it. Now, the side effects here are usually mild, some dizziness, leg cramps, but there's a reason this medication isn't the first line of defense. In animal studies, high doses over long periods increased the risk of bone cancer. Now, before you panic, let me be clear, no cases have been reported in humans. Still, doctors err on the side of caution. They'll review your medical history thoroughly before suggesting it. And if you're on it, you'll have regular check-ins to make sure everything's on track. Now, I can almost hear some of you asking, what about hormones? My sister's on estrogen, isn't that an option? You're absolutely right. Hormone therapies, like estrogen or selective estrogen receptor modulators, SERMs, for short, were some of the first treatments for osteoporosis. They can help maintain bone density, especially in women after menopause. But here's the catch: hormones affect more than just bones. For some, the benefits outweigh the risks. For others, the potential side effects, like blood clots or breast cancer concerns, make them a less ideal choice. The key takeaway? There's no best medication, only the one that's best for you. Your lifestyle, your health history, even your personality, are you a set-it-and-forget-it person or someone who doesn't mind a daily routine? All of that matters. And that's why working with a doctor you trust is so important. They're not just treating a disease, they're partnering with you to protect the life you love. Of course, medications are only part of the story. What you eat, how you move, the little daily choices, they all add up. And that's where we're headed next. Because building a full, vibrant life with osteoporosis isn't just about managing risks, it's about embracing possibilities. You know, when my neighbor Carl started his osteoporosis treatment, he said something that stuck with me: it's like building a team, every player has a role. And he's right. We've talked about some key medications, but there are a couple more team members you should know about. Let's start with a newer player on the field, Romosozumab, often called by its brand name, Evenity. Now, this one's interesting because it's a bit of a double agent. For the first time, we have a medication that both builds new bone and slows down bone loss. It's like hiring a construction crew to rebuild a wall while putting up a keep out sign for the wrecking crew. You get it as a monthly injection, usually for a year, and studies show it can cut the risk of spinal fractures by nearly half compared to some older medications. That's powerful stuff. But, and there's always a but, Romosozumab isn't for everyone. Because it's so effective at building bone, there's a small risk it might increase heart strain in some people. If you've had a heart attack or stroke in the past year, your doctor will likely steer you toward other options. But for many, especially those with severe osteoporosis who haven't responded to other treatments, this medication can be a lifeline. It's all about finding the right fit. Now, let's talk about an older, quieter member of the team, calcitonin. You might remember this one from years back. It's been around since the 80s. It works by calming down those bone-breaking cells we talked about earlier, and it comes as a nasal spray or injection. But here's the thing, while it's gentle and easy to use, it's not as strong as newer medications. These days, doctors often reserve it for folks who can't tolerate other options, or for short-term pain relief after a fracture. Think of it like a reliable backup singer, not the star of the show, but still part of the chorus. Of course, no conversation about bone health is complete without mentioning the basics, calcium and vitamin D. They're the foundation, the bread and butter of your bone health team. But here's the catch, they're supporting players, not standalone treatments. You can't out-supplement a crumbling foundation, but without them, even the best medications can't do their job. So keep taking that daily vitamin D, enjoy that yogurt or leafy greens, and let your meds handle the heavy lifting. Now, if there's one thing I want you to take away from all this, it's that you have choices. Whether it's a weekly pill, a twice-a-year shot, or a daily injection, there's a path that fits your life, your body, and your peace of mind. And remember, side effects aren't a guarantee, they're just possibilities. Your doctor's job is to help you navigate those risks, and your job is to speak up. If something doesn't feel right, say so. You're the CEO of your health, after all. So, what's next? Start that conversation with your doctor. Bring notes, ask questions, and don't be afraid to revisit the discussion if your needs change. And hey, share what you've learned today with a friend. Maybe you'll be the Linda in someone else's story, giving them the courage to take that first step. Before I go, I'd love to hear from you. Have you found a medication that works for your lifestyle? Or maybe you've discovered a tip for staying consistent with your treatment. Drop a comment below, let's keep this conversation going. And if this video helped you, do me a favor, hit that like button, subscribe if you haven't already, and share it with someone who might need a little extra encouragement today. However your journey unfolds, remember this, you're not just managing a condition. You're investing in a life full of moments that matter, grandkids' birthdays, morning walks, laughter around the dinner table. And that's worth fighting for. Here's to strong bones, brighter days, and living your version of a full, vibrant life.